let us try to understand the Ministry of the Modern Medicine, Western Medicine budget, and then go to the AYUSH budget. So, as I've already discussed, 1,06,530.42 crore has been allocated, which is a 10% increase from last year. Last year it was around 89,000 crores. And Nirmala Sitharaman ma'am started off with telling that they want to start a national center in northern India for the mental health welfare of the North Indians. And they would be starting NIMHANS, and with its apex centers being at Ranchi and Tezpur. So for allopathic and AYUSH doctors and common man, there are fans of AYUSH medicine who always want that AYUSH also reaches that 1 lakh crore, right? So you should all understand that even though the central government allocates budget for allopathic field of pharmacy or hospitals, now that India is going towards integration, along with allopathic doctors reaping the benefits of this budget, there would also be AYUSH doctors who will be involved in all allopathic care centers, and hence the AYUSH doctors will also be tertiary beneficiaries. Okay, they would not be seen as the tangible source, right? The tangible people would be the modern Western medicine, and intangible, right? The hidden benefits would also reach the modern Western, AYUSH doctors that you have in mind. So FMM has also discussed as to how 5 medical tourism hubs would be established in partnership with private sector. This is very important. Again, as I told, this is not just earmarked for allopathy. Medical tourism, in last year's budget itself, India has proposed that AYUSH tourism would be promoted. And when I attended a seminar, I found that the government submitted that there were, say, 10 to 50 people who have selected AYUSH visa. I don't remember. It was just countable numbers from different countries. So they are just setting the process with different countries, have already reaped the benefits of AYUSH visa. What would be special about AYUSH visa? Look at the way the government is thinking. Because a normal visa will have some mechanisms. While you give an AYUSH, while you take an AYUSH visa, the government will be able to track and connect this tourist to specific AYUSH specialty hospitals, and best services would reach the tourist, and we would also be able to track who is delivering what benefit. We will also have a control mechanism as to who is coming into India and going to India, and the quality of services shall also be can also be controlled, right? This is one of the success which India has hit as an AYUSH practitioner. And so this medical tourism hub, in the name of medical tourism hub, they have tied up with 5 private players, allopathy players. They have not mentioned Ayurveda players for now. Why? Because it is a huge industry, and they would be surely connecting with centers like Kottakkal or Dabur, and the huge players as Zando or other hospitals. SKM, there is one Ayurveda hospital in the north, and huge hospitals they would be surely coming and connect with them, I'm sure. So Apollo, Max, Fortis, Dr. Lal Path Labs and Metropolis these would be developed as 5 medical tourism hubs for both allopathy and Ayurveda. How will Ayurveda come into play into allopathic centers is your doubt. People who are not aware of what is happening in Apollo hospitals, it is a 2 or 3 year old news. Apollo has already got stakes of 65% from an AYUSH hospital, Ayurveda, and it has already started its full-fledged centers and practice in Chennai. So Ayurveda was set up by Dr. Rajiv, and I think it is a Karnataka-based AYUSH chain of hospitals, and this has been inculcated. This has gone into a partnership with Apollo. So just like Apollo, they would be encouraging probably Max, Fortis, and Dr. Path Labs and Metropolis. All allopathy centers would start taking AYUSH projects and setting AYUSH centers and employing AYUSH doctors. So the job opportunities for AYUSH doctors is going to increase. And by ensuring that huge allopathic chains are involved, they are also ensuring that proper revenue and proper quality and proper standardization would be involved, and it would be even easy for clinical trials and researches to be carried out in these centers in integrated model. And if at all some emergency also arises, they can be easily referred to such centers, and there would be lots of respect for such centers, because both allopathy and Ayurveda are involved. This is one of the most beautiful agenda which the center has set.